I just completed my Master of Science in Pharmacology at the University of British Columbia and have also joined Impact as well as C4T. My master's research project was led by Dr. Rod Rasick and Dr. Hal Seiden, which aimed to characterize the prevalence of medicinal cannabis use in children and youth, describe practices of use and sources of information for families, to understand attitudes and opinions, and to identify any challenges that families may. And thank you again for joining today. Some of you may have seen this presentation on this project back at the conference in the spring, but I'm excited to share some updated results. I'd like to begin by acknowledging that this research was conducted on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. This research was funded by a BCCH oncology family donor, and my master's was funded by the Canuck Place Children's Hospice Foundation, as well as CIHR Canadian Graduate Student Mastership. For a brief overview, as many of you know, parents and caregivers are increasingly choosing to administer cannabis for medicinal purposes for their child, especially for children and youth with complex needs and symptoms that are not being sufficiently managed by conventional medications. There's limited high-quality research, such as clinical trials, that exist for pediatric use. So CBD has been shown to reduce seizure frequency for treatment-resistant epilepsy and pediatric syndromes, and CBD and THC is used by oncology patients to reduce symptoms and side effects of treatments, and cannabis is becoming more widely used for many symptoms, including pain, spasticity, dystonia, anxiety, and more, for a range of conditions, including motor disorders, behavioral disorders, and so on. Regarding pediatric use, physicians report facing uncertainty regarding benefits, dosing, and side effects, and families are facing barriers to access through authorization and are turning to lower quality products obtained from the community. And families may not be disclosing use to physicians. There's several gaps in the literature regarding medicinal cannabis use in the pediatric population. There's no description of the prevalence of use for children and youth, reasons families are choosing to use cannabis, or how they're obtaining and using cannabis for their children. There's no description of the cannabis products that are being obtained from the community and administered by parents to their children for therapeutic reasons. And there's little evidence of efficacy of cannabis use and a lack of dosing and safety information for medicinal use in pediatrics. So the objective of our study was to investigate the prevalence, practices, and family attitudes and reasoning for medicinal cannabis use in pediatrics. There are 3 phases to this study. The first phase was a qualitative pilot study that consisted of 10 interviews with families at BC Children's Hospital Oncology Clinic and Canuck Place Palliative Care Clinic. These interviews were conducted to inform the design of our survey, and then the survey was piloted in stage 2 in BCCH oncology clinics to review the survey and inform revision. This data is from phase 3, which was surveyed many clinics and programs at BCCH and Sunny Hill Health Center, which is a developmental pediatrics unit. So we aim to characterize the prevalence of and reasoning for pediatric medicinal cannabis use. Medicinal cannabis was classified as use of any cannabis product for therapeutic purposes, including synthetic or natural, pharmaceutical grade, commercially available, or personally grown and handmade products. We aim to describe practices of medicinal cannabis use and sources of information for families, to understand parent and caregiver attitudes and opinions about medicinal cannabis use in pediatrics, and to identify any challenges families may face regarding medicinal cannabis use, regardless of experience with use. For recruitment, a research assistant was stationed in a clinic for 2 or more weeks, depending on clinic traffic and recruitment numbers. Participants were approached after they checked in for their child's appointment while seated in the clinic waiting room of the majority of clinics we recruited from. The exception to this was in oncology inpatient and outpatient units, where participants were approached in patient rooms, as these units don't have waiting rooms. All parents and guardians 18 years of age and older that were attending an appointment with their child were eligible to participate, regardless of experience with medicinal cannabis use by their child, provided they were able to complete our survey in English. The survey obtains demographic information, clinic attended, and the condition of the child, as well as use-specific and non-use-specific questions. The survey included both closed and open-ended questions for participants to reflect on their attitudes towards medicinal cannabis use for their child, and if applicable, their experiences regarding their child's medicinal cannabis use. Survey questions Material included medicinal cannabis usage and practices, reasons why they decide to use or not to use cannabis, and current understanding about safety, side effects, and regulations. And on to results. The results I'm sharing today are key results, so if you have any questions about results we might have that I didn't discuss today, I'd be happy to discuss during the question period. And I'm also going to be moving fairly quickly to share as many results as possible in my allotted time. So for our prevalence, the clinics with the highest prevalence were oncology inpatient unit, the neurology unit, and hematology, as well as the oncology outpatient unit. The diagnoses with the highest prevalence of use were headache, tone and movement disorder, and neurologic disorder with seizures. And note the wide range of diagnoses of children that are using cannabis for medicinal purposes. We had a fairly even number of male and female children of participants, and the ages of users range from 5 to 25 years old. When asked what their opinion of future regulation for medicinal cannabis for children, parents and guardians mostly reported that they think it should be regulated like a drug, like other pharmaceutical medications, with a higher percentage of parents of users indicating that they think it should be regulated as a alternative health product like supplements. When asked if they think it should be covered by insurance for children in the future, the vast majority say yes, they do think it should be covered, regardless of whether their child has used medicinal cannabis or not. Our overall prevalence of use here was 7.68%, with 51 users and 613 that have not used medicinal cannabis. Multiple variables predicted who was using medicinal cannabis. Age, so children that were of older age, and those that indicated that their child has a tone and movement disorder, those that have a supportive healthcare provider, and caregivers that have personally used cannabis for any reason. All of these children are more likely to use cannabis for medicinal purposes. Children that are of Asian ethnicity and children with parents that consider medicinal cannabis to be a drug like other pharmaceutical medications, those children are less likely to use cannabis for medicinal purposes. Now on to the practices and attitudes of caregivers of children using medicinal cannabis. The highest reported reasons for use were pain, seizures and epilepsy, anxiety, appetite improvement, and nausea and vomiting. And again, we have a range of use reasons reported. When asked if they're using other treatments for their use reasons, the majority are using other medication for these use reasons. The only group that wasn't using more, the other group that didn't have more people using other medications was those that are using it for sleep. When asked what was the factor that made them decide to use cannabis for their child for medicinal reasons, the highest group reported that the reason was unsuccessful conventional medications. And then next, people reported using because of side effects of other medications, success stories from other patients, and family or friend recommendation. When asked if their child's healthcare provider is aware of use, only 72% is aware of the child's use, with nearly 30% not being aware. And when asked to rate how they perceive their healthcare provider's knowledge of use from 0 to 6, with 0 being their healthcare provider has no knowledge about use, with 6 being their provider has complete knowledge about use, they reported a really wide range here, with many reporting that their healthcare provider knows nothing. When asked where they're getting their products, the majority reported that they obtained the product on their own from a dispensary in the community, and the next highest group reported getting it through their through authorization from their child's healthcare provider. And we wanted to see what predicts if a family will obtain from their healthcare provider. And so if the family, the parent or caregiver, considers that cannabis is a drug like other pharmaceutical medications, and if the child has a neurologic disorder, they were more likely to obtain from a healthcare provider. And then families who were recommended medicinal cannabis use from family or friends. And if the parent or caregiver personally uses medicinal cannabis, they were less likely to obtain the product from their healthcare provider. Now, for those that are obtaining from dispensaries, families were less likely to obtain the product from dispensaries if they have had unsuccessful conventional treatments and if their healthcare provider is aware of the child's use of cannabis for medicinal purposes. The majority are getting information about use from online web searches, and with the next groups getting information from healthcare providers and family, friends, or other parents in the community. When asked to rate their own knowledge, participants tended to rate their own knowledge compared to their healthcare providers a little bit higher, with many reporting that they have complete knowledge about medicinal cannabis use for children. The majority have used or were using medicinal cannabis for over 2 years, and 55% are not currently using medicinal cannabis. And when asked the reasons for stopping, the majority stopped because of no improvement in condition or that they no longer feel that their child needs the product. 69% believe cannabis is helping their child. And of those that indicated that cannabis is helping or unsure, when asked how, the majority said that is treating the symptom of concern or improving other aspects of their child's health. The majority reported no side effects, with the next group, highest group, reporting drowsiness. And of those that reported side effects, only 3% or 14% indicated being concerned about these side effects. One person indicated a severe reaction. However, they didn't specify specifics about this reaction. They didn't say whether the child had to attend an emergency department or not, or what the type of reaction was. Now, trying to predict who cannabis is helping, only one variable was correlated to this, and this was concern about short-term side effects. So if the parent was concerned about short-term side effects, they were less likely to consider cannabis to be helping their child. When asked about concerns about the product, the majority reported concerns about costs and affordability and regulations in Canada, long-term side effects, product quality and contents, and inconsistent access. The majority reported no social concerns, but many reported concerns about international travel with the products, lack of support from healthcare providers, and the legal status of medicinal cannabis for children. When asked what future research, many reported needing more information about dosing, amount, duration, or frequency, wanting to know which children are most likely to benefit and what those benefits could be, as well as long-term side effects. And when asked if they recommend medicinal cannabis to other children with similar conditions, 98% said yes, they do recommend it. Now, some practices and attitudes of caregivers of children not using medicinal cannabis. 13% think it could help their child. And for those that said yes or they're not sure, when they're asked for what reason they think it could help, the majority reported pain, anxiety, sleep, and appetite improvement. The reason for not pursuing use was not enough evidence that it will help or drug safety concerns. Many indicated other reasons as well, and the majority of these people specified that it just wasn't offered by their healthcare provider. They didn't think their child needed it, or they just hadn't considered it. The majority don't have any information about medicinal cannabis use for children. And then the next group gets their information from healthcare providers about use. When asked if they would change their decision not to use, if there was a Health Canada certified prescription product for children, they were more likely to be sure that their decision not to use medicinal cannabis would not change, so they still wouldn't use it, if they don't think it should be available for children in the future, or if their child has a diagnosis of limb difference. And they were less likely to be certain that their decision would not change if they're of First Nations ethnicity, if they had a complex behavior problem, or if they had some trust in TV or news. And then they were more likely to believe their decision not to use would change, and they would decide to use cannabis for their children if they think it should be regulated as an alternative health product in the future, and less likely if they don't think it should be available for children in the future. In summary, headache, tone, and movement disorder and neurologic conditions with seizures were the highest ratio of reported users. Pain, seizures, and anxiety were the highest reported reasons for use. And unsuccessful conventional medications were the highest indicated deciding factor for use. And noting the intersectional decision to use cannabis, including age, ethnicity, diagnosis, healthcare provider support, and caregiver personal use. Nearly 30% of physicians are not aware of the child's cannabis use, and families are obtaining from the community and obtaining information from the internet. And with children using concurrent medications for these reasons, this raises concerns about potential drug interactions if the physician is not aware of use. And most believe cannabis is helping their child, and the majority report no side effects. Families need more information for dosing and safety. They're concerned about cost, and most believe it should be covered by insurance. And all but one recommend the use for other children with similar conditions. And many are concerned about the lack of support from their healthcare provider. Of non-users, few think it could help their child, but of those that do, they decide not to pursue due to not enough evidence it could help or drug safety concerns. And most report having no information about use. And 34% say that their decision not to use medicinal cannabis for their child would change if there was a Health Canada certified prescription product for children. Expected implications of our study are to support the understanding of prevalence of reasoning for and practices of pediatric medicinal cannabis use, to inform clinicians, clinical policymakers, and advocates for patient health and safety, and to provide a foundation to lead to further research and clinical trials to inform development of guidelines for medicinal cannabis use in pediatrics and resources for families. And limitations, we weren't able to recruit everyone, but we think our sample is representative of the population. In the future, we plan to look at the product's contents that families are using. And thank you. Are there any questions?
Thank you so much, Jodi. That was fantastic.